Good morning, and thank you for joining us for our D.C. Government Telephone Town Hall on COVID-19, also known as coronavirus. My name is Tomas Talmante, Deputy Chief of Staff to the Mayor. In just a minute, you'll hear directly from Mayor Bowser. And with Mayor Bowser, we have our Director of D.C. Department of Human Resources, Ventress Gibson, our Director of Homeland Security and Emergency Management, Director Chris Rodriguez, City Administrator Rashad Young, our Chief of Staff to the Mayor and Deputy Mayor for Planning and Economic Development, John Felchicchio, and Dr. LaQuandra Nesbitt with DC Health. Without further ado, we'll kick it over to Mayor Bowser.
Good morning, everybody, and thanks for dialing in. And I want to thank you for all of your cooperation, and then thank you in advance for doing all the things that we will need to do to keep D.C. government operational and serving our residents during what is really unprecedented, I think, in D.C. history. You know, this week I declared a public health emergency in Washington, D.C. We've ordered some, we've prohibited some mass gatherings in the city. And this morning I announced that we would be closing D.C. public schools. Next week, our public school students will be on spring break, and the following week they will receive instruction for distance through distance learning, and they will return to school on April the 1st. Likewise, this morning I announced, as I did with the members of my cabinet yesterday, that we have been working on a telework policy that will allow us to keep all of our critical functions operational, but also support what is prudent health-wise to contain the spread of this virus by helping to limit movements. And if we're able to limit movements of our staff and personnel, we're going to work to do that. So we have been very thoughtful about how to keep government operations going in consultation with your directors. And following our discussion, I will be sending each of the directors some guidance on how to handle their agency. And the directors, of course, know the operations and know what's need to be done. So they will be communicating to you directly of all of the needs of the agency following that. And we hope to get that out to you midday by noon for your own consideration and planning. So with that, again, thank you. Hang in there. Take care of yourselves. Take care of your family. Make sure you have a plan for your family, child care, elder care, paying bills, moving around, getting food and supplies. Make sure you know what you need to do if you need to be in contact with your own doctor and have that on the ready. And I know that together we will prepare for our residents, we will deliver services, and we will get through this crisis. So with that, I want to kick it over to the CA to continue to talk to you about our continuity of government operations.
Bowser. Thank you, Mayor Bowser. Good morning, everyone, and thank you all for joining us on the Employee Town Hall. Thank you for those introductory comments, Madam Mayor. Certainly, with the whirlwind of activities and changes and announcements over the previous days regarding our region's response to coronavirus, as the Mayor indicated, we wanted to pause and make sure that employees hear directly from the Executive Office of the Mayor. In response to this coronavirus pandemic, our priority from the start has been to protect the health and safety of our residents, our employees, and the visitors to the district. We also have made a commitment to continue serving our residents, particularly those who receive critical services, as this is the function and role of government. As the Mayor pointed out, over the last 2 weeks, she's issued a mayor's order in response to the coronavirus, declared a state of an emergency along with a public health emergency, and requested that DCHR make an all-personnel issuance. Each of these actions has allowed the district to remain nimble and attentive to the needs of our city and our employees that are responding in this pandemic. As a result of these orders, DC Health and the Department of Homeland Security and Emergency Management are leading the district's comprehensive response to the pandemic. And as of this morning, we have activated our Emergency Operations Center, which includes our Joint Information Center, which handles centralized communications during this event. Both functions are located at DC Health, and that's where we're operating out of this morning. This means that there are representatives from our responding agencies from across the government that are reported to this EOC and will work from this location, until which time we stand down those operations. We've also made operational adjustments to support the work of our first responders, move forward with plans for our schools, and we've asked every agency to review and update its continuity of operations plans in the event we have to re-envision and continue to re-envision how we serve our residents. In every case, the health of our employees and the safety of our employees is paramount. So we're going to talk about where we are today in the evolution of this pandemic, and Dr. Nesbitt will tell us what they're working on and what the state of affairs is from the health side, and then Dr. Chris Rodriguez from Homeland Security and Emergency Management will talk about our preparedness and a little bit more about how we're responding to this effort. So, listen, thank you all for your continued commitment. Thank you all for thinking about, and I know being concerned about how we serve our residents and make sure that they have the critical services that we need for this city to continue to function. And so with that, let me turn it back over to Tomas, who will then guide us to our next discussion.
Yep. Thank you, City Administrator. We'll now hear from Director Chris Rodriguez on emergency preparedness.
Thank you, and good morning, Mayor. Good morning, everyone. As the Mayor mentioned and the City Administrator also discussed, since the Mayor issued her first executive order on February 28th, the Emergency Operations Center has been activated. With the declaration of emergency a couple days ago, we did work with DC Health to create a unified EOC at DC Health's Health Emergency Coordination Center. We are in the process now, and we already have activated the district's response plan, and our goal is to, as the Mayor mentioned, flatten the curve, which requires bold and aggressive action to combat the spread of the virus. Our primary functions right now are to coordinate with key agencies across district government, to centralize our procurement activities related to this incident, and also to share and receive best practices with other sister states that are dealing with this incident as well, all across the country. With the Joint Information Center activation, we have pushed dozens of information products to residents and to the public, and we will continue that effort for as long as it takes. As the Mayor mentioned in her press conferences, we also have identified a quarantine location, and we're preparing to expand capacity as necessary. We want to make sure, first and foremost, that with this unified EOC, that we are able to make sure that district government can continue to deliver essential services. And the Mayor and the City Administrator have approved our structure for the EOC in ensuring that we can provide those services. Before we turn to Dr. Nesbitt, Tomas mentioned earlier coronavirus.dc.gov. That is the authoritative source for information on the virus, particularly as pertains to district government. I would also add that employees should also, if they haven't already, please sign up for Alert DC, and you can do that at alertdc.gov, and you'll get real-time information on this incident and others throughout the district. And thank you, and I'll now turn it to the Director of the D.C. Department of Health, Dr. LaQuandra Nesbitt.
Thank you so much, Director Rodriguez, and thank you, Mayor Bowser, for hosting this employee town hall for us this morning, giving us an opportunity to share information about COVID-19. On February 11, 2020, the World Health Organization announced an official name for the disease that is causing the 2019 novel coronavirus outbreak that first was identified in Wuhan, China. The new name of this disease is coronavirus disease 2019, abbreviated as COVID-19. It's important to know that there are many types of human coronaviruses, including some that commonly cause mild upper respiratory illnesses that mimic the common cold. And COVID-19 is a new disease that has not previously been seen in humans. As of March 12th, the World Health Organization reports over 125,000 cases of COVID-19 that has caused over 4,600 deaths around the world. In the United States, there have been over 1,700 confirmed cases of COVID-19 that have resulted in 40 deaths, many of which have occurred in Washington State. In the District of Columbia, we have 10 cases of COVID-19, and there have been almost 40 cases of COVID-19 in the DMV region. Our cases of COVID-19 have been linked to travel or contact with other individuals who have a laboratory confirmed case of COVID-19. However, we do have 2 cases where there has been no known exposure, which means that there is evidence of community transmission in the District of Columbia. To date, we have investigated 67 persons for COVID-19 that have led to those 10 identification of those 10 positive cases in the District of Columbia. We are still learning more about the symptoms of this virus. But the 3 hallmark symptoms are fever, cough, and shortness of breath. What you can do to help prevent the spread of coronaviruses and the disease COVID-19 is to do basic community hygiene practices such as wash your hands with soap and water for at least 20 seconds, multiple times a day, and if soap and water are not available, use an alcohol-based hand sanitizer. When you cough into your elbow or upper sleeve if you do not have a tissue available. And if you use a tissue or Kleenex, please discard it immediately into a trash receptacle. You should avoid touching your eyes, nose, or mouth altogether. And if you before you eat, you should definitely use soap and water for 20 seconds or more, or the hand sanitizer previously mentioned. You should keep surfaces, including bedside tables and all high-contact surfaces in the workplace, cleaned often using a common household disinfectant, including disinfectant wipes. In the district, we have testing guidelines for coronavirus that requires you to seek care from a healthcare provider. That healthcare provider will use their best clinical judgment to determine if you if you are showing signs and symptoms of coronavirus and should be tested. The clinician can choose to have you tested through the district's public health laboratory, or they can have you tested through a commercial laboratory. People who we are testing through the public health laboratory must have fever or signs and symptoms of a lower respiratory illness such as cough or shortness of breath, and have been in close contact with someone with COVID-19 within the past 14 days of the onset of their symptoms. Individuals who have fever or cough or shortness of breath and have a history of travel to level 2 or 3 countries with a travel advisory. That list is updated frequently on our website within the past 14 days of onset of symptoms, or individuals who have fever and cough or shortness of breath and reside in a nursing home or long-term care facility within 14 days of the onset of symptoms. We do advise residents, including employees, who have traveled to level 2 or 3 countries within 14 days to remain home and social distance for 14 days after they arrive back to the U.S. As the mayor mentioned, we released an advisory on March 11th for all non-essential mass gatherings, including conferences and conventions, to be postponed or canceled in the district on until March 31st, as well as recommending that in events that are social, cultural, or for entertainment purposes that draw large crowds to be suspended by the organizer. These are part of our social distancing measures that should be underway when evidence of community transmission is present in our community. All of these measures are things that we know will help us to reduce the spread of coronavirus and COVID-19 in the District of Columbia. We make sure that we express to people that close contact is defined as being within approximately 6 feet of a person who has COVID-19 for prolonged periods of time or for 10 minutes or more. So casual contact is not sufficient for the spread of the virus. So those are the types of things that we take into consideration when someone believes that they may have been in contact with a person that they believe has COVID-19. For more information, I do want to reiterate that we keep our website, coronavirus.dc.gov, up to date with information and with the CDC's most up-to-date guidelines. And with that, I'll turn it over to Director Gibson.
Good morning, and thank you to the Mayor for this opportunity to share more information from the HR perspective. Under her leadership, we were able to relax provisions governing hiring so that we will always have the ability to hire where needed. We also have clearly defined various leave categories to include sick leave, annual leave, leave without pay, administrative leave, and other types of leave that will assist should an employee need that. As to telework, there are 3 buckets that the Mayor has approved for us to move forward, and as she stated, guidance will be forthcoming. Let me describe briefly those 3 buckets. The first would be agencies that permit 100% telework. The second bucket is some telework is authorized and some positions cannot do so. And the third bucket is an agency that cannot telework, period, nor any within the agency. So those are the 3 buckets, and that's the guidance that our agencies will receive. For essential and emergency designated employees, essential employees and emergency employees are those who are required to report to work. Those conditions and that designation has not changed, but our agencies will be making sure that their lists are not only updated, but if we have to add as appropriate to meet the needs of the residents we serve, we will certainly do so. We have worked with our 4 healthcare providers to ensure that if any employee is tested, that there is no charge for that testing or for the follow-up care relevant to the testing. And we also understand that some employees may fear what is going on for you and your family. For that reason, our Employee Assistance Program, which is under INOVA, and you can go on to dchr.dc.gov, and we will have a link to that, to INOVA, and there is available therapy, etc., for just talking if you need to talk to someone or if you're really concerned. What I do want to spend just a quick moment on is if you are sick, and to complement further what Dr. Nesbitt and others have said, as well as the CDC guidance, if you are sick, do not come to work. But you should call your supervisor to let your supervisor, of course, know. Secondly, you should seek medical attention. And if you believe that you have the symptoms associated with COVID-19 or you've traveled to one of the level 2 or above 8 countries, or in fact, if you know you've been exposed to someone who has tested positive or potentially believes they have, then you should in fact self-quarantine, seek medical attention. Should you be required to be self-quarantined or quarantined, you will be not charged leave but placed in an excused absent capacity. But again, seek medical attention. The other key item is you cannot return to work until you have medical clearance from a physician, which means you must obtain medical certification. And of course, we would ensure that because we're trying to level the curve or flatten the curve. That being said, DCHR has established a call center, and the number is 202-442-9700. Yesterday, we received over 50 different calls. Thank you for reaching out. And we also have an email address, askhrcovid19.dc.gov, and thank you for the questions that have come through there. We will categorize those questions and ensure that they're placed on the website so that we can share it with others as well. Thank you.
All right. Thank you so much, Director Gibson. And in the interest of time, we do have a few questions that were sent by employees that we will address. And again, just to remind everybody, coronavirus.dc.gov for all your up-to-date resources. So the first question we have is, if a sick person shows up at my building, should we shut down and deep clean everything?
There is not a recommendation to close any operations or suspend any operations if an employee leaves the workplace sick. We use the same recommendations that we use during our normal day-to-day operations. If an employee leaves the office because they are sick with signs and symptoms of any respiratory illness or signs and symptoms of COVID-19, it is not necessary to close the floor, office, or building, or to send any coworkers home to self-quarantine at that time. If the employee receives care from a healthcare provider and based on the clinician's judgment is tested for COVID-19 and their result is positive, the health department will start a contact investigation, whether that be DC Health or the health department in the employee's home jurisdiction if they are not a DC resident. That investigation will identify any coworkers who came into close contact the way I previously described it, and with the employee who went home sick. The coworkers and the employer, in this case the DC government agency, will receive instructions as to what should be done at that time. There's no need to take any precautionary measures prior to that when an employee leaves the office when they become ill. DC Health is not establishing separate processes for district government agencies than what we do for any employer throughout the district, and agencies are encouraged, highly discouraged, from establishing independent protocols that are not driven by science or supported by evidence and that may conflict with district personnel policies.
Thank you, Dr. Nesbitt. Our next question is, can I expect to hear by Monday about my position and the announcement related to telework from my agency?
You actually should expect to hear today. So guidance is going out to cabinet members and agency heads today as to which category that particular agency is in with respect to telework. Those two categories, again, being all of the agency is eligible for and can telework. There's a modified telework schedule, which would be the second bucket, which means some within an agency will have to report to work because they are essential, and others can telework, and then the third bucket being no telework. So agencies will get that communication today, and then agency directors will send out to their employee groups the specific actions and activities of how to execute that telework policy and guidance. So people should receive that today.
Thank you, City Administrator. And our last question is, what is the fastest way I can get alerts on the latest changes in the district's response to coronavirus?
So this is Chris Rodriguez from DCHCMA. Again, I would say that please go to coronavirus.dc.gov, and also please sign up for Alert DC, which is our 24/7 real-time alerting system at alertdc.dc.gov.
All right. Thank you, Director. And again, just as a reminder to everyone, I'm going to reemphasize that for the most up-to-date information, resources, and all of the latest updates, please visit coronavirus.dc.gov. We will also be administering to all buildings today posters as well as resource guides to distribute out to community members and to have posted at your facilities. So the Department of General Services will ensure that all of those materials are out to your respective agencies by COB today. So you be on the lookout for that as well.
Let me just, again, thank all of those who are on the call. Thank you for listening in. Please take this information back, share it with your coworkers. We are videoing, recording this, so we will send this out to other employees who didn't have the opportunity to make it on the call. I just want to, again, on behalf of Mayor Bowser, thank all of our employees for their diligence, for their focus, for remaining focused on the residents of the District of Columbia. Please review the information that we've sent out. Put your family plans together, your personal plans together. Be aware, practice good hygiene, wash your hands, use hand sanitizer. So thank you all, again, for all of your hard work and for being with us as we go through this event.